For those of us who are looking at Medicare, many find it confusing, to put it mildly. The good news is that there are trained professionals who can guide us to clarity. Gina Downs is the Vice President of Senior Connections, and she is here to help. So thank you ahead of time.
Thank you.
It is confusing, and there just changes happen all the time.
Yes.
So for you, what are the most commonly asked questions?
Well, there's a lot of confusion as to what Medicare will pay, especially when it comes to a physical. Most people think that they can have a yearly physical. When you're on group insurance, you go to the doctor, get your yearly physical, get blood work. Medicare does not cover a yearly physical. They will cover a yearly wellness exam. What's the difference? A physical is much more in-depth. They usually run a full panel of blood work. A wellness exam is very baseline. Check your height and weight, check your blood pressure. How are you doing? Is there anything you're concerned about? That's about it.
So it's all about the language.
It's about the language, yeah. They'll tell you what is available as far as screenings on a particular timeline, but it's very limited for the coverage.
Well, that's good to know. All right, we have to write that down. Know your definitions, first of all, because I wouldn't have thought about that.
Yeah, it's definitely a vocabulary lesson when you come on to Medicare. Physical versus wellness. And if you ask for a wellness exam or they charge it as a wellness exam, you will pay 100% of the cost, which usually ranges between $170 to $174.
Well, so if you call and ask to have your yearly checkup, you need to know what to ask for.
Yes, ask for a wellness exam.
Otherwise, cha-ching.
Not a physical.
Not a physical. But if you need a physical, it's going to have to just be what it is?
Yes, and if there are problems, the doctor can run tests. If they have blood work that they want to do, it needs to be diagnostic. If you're in your wellness exam and they want to run your A1C or check your blood glucose, it cannot be done on the same day. You have to come back for a separate appointment on a different day. Otherwise, you will be charged for it. So if you're having problems, the doctor can check for it and run blood work, but it needs to be on a different day. And there has to be a reason for them to check it, not just because you want to know what's going on. You can know what's going on with your blood work, but you're going to have to pay for it.
That is so interesting to know. So do the medical providers know to say you need to come on a different day in order for Medicare to pay for this?
Unfortunately, some do and some don't. There are some doctors that are wonderful about communicating with their patients about what Medicare will provide. And there are others that they are just as confused about the Medicare coverage as the Medicare beneficiary themselves. So we have really tried to talk to doctors and educate them as well so that they can help their patients while we're also helping them.
Yeah, because I really would look to my professional to know the answer to that, because I would be new to the system anyway. Well, how do we verify, who verifies coverage? How do we verify coverage?
The billing department can. When in doubt, have the billing department verify with Medicare whether it's going to be approved before it's done. Because once the billing has gone in and it has been coded, it is very hard to get it reversed or recoded to the appropriate amount. And so if you can verify beforehand, that's going to help you out in the long run.
Is your head spinning? Because mine is. But that's why we have Senior Connection and Gina and our wonderful, wonderful group to help answer these questions. So know your language, right?
Yes, absolutely.
Know the words, know the terms.
Brush up on your vocabulary.
Okay, check with Senior Connection. Thanks, Gina. And we'll be back with more local lifestyle, some great music from Tim Ash right after this.
This portion of Lifestyles has been sponsored by Senior Connections.